Right, so that was just to give you all a little flavor of the work that we've been doing over the last 2 years. Now, this slide is intended just to give you a summary of the mobile health research that has been going on. On the vertical axis, we have it in 2 groups, the physiological monitoring as well as the patient communication support. And then going across horizontally, we have sensor placement, whether it's portable, like the device you saw there, wearable, or implantable. Information flow, upstream from the patient to the provider, downstream from the provider to the patient, or two-way. And communication type, whether it's data, text, multimedia, or two-way video. I just want to concentrate on my area, which is the health education and promotion. So currently when it comes to the information flow, it's downstream, that is from provider to patient, and now we want to look at the future, which is what the F stands for, which is two-way. When it comes to the communication type, it's purely text, but we're looking at going into multimedia as well as two-way video. Now we get into my research. The hypothesis for my thesis is essentially the use of mobile telephony as a platform for DSMS will improve the accessibility, availability, relevance, and affordability of DSMS, thereby improving the patient's knowledge of diabetes, self-care practices, and overall quality of life. The colors were chosen on purpose. The blue represents essentially the problem with the existing systems, that is the lack of accessibility, the lack of availability, the lack of relevance, and the cost associated with managing diabetes, as well as the characteristics of the mobile phone. It's accessible, it's available, it can have processes that are tailored and therefore relevant, and it's fairly affordable. The red now is essentially my measurable outcomes. Patient's knowledge of diabetes, his self-care practices, and his overall quality of life. So my research objectives would be to demonstrate how the use of mobile phones can serve to improve accessibility, availability, and affordability of DSMS, to demonstrate timely, personalized DSMS can improve the ability of patients to take care of themselves, to deliver DSMS at precisely the right times when, and at precisely the times when and places where it can have the greatest impact, and of course to improve patient outcomes and lower related costs through patient engagement. One of my first research questions will be, how does the DSMS MLearn session differ from the traditional MLearn session? When we think of MLearn, which means mobile learning, we usually think of it as a student, because anybody who's going to learn is a student, going to enter into this class or class setting meaning a course is going to be taught and then there's some evaluation at the end. Now whether it be that they do it at home or in an actual classroom, they willingly enter, as well as they know the intent is to go through some sort of formal teaching. With DSMS it's a little bit differently, because here we're talking about somebody's healthcare and they wouldn't necessarily say, okay, I'm going to learn about my health at this time every day, as well as when you really stop and think about what is the evaluation? How are we going to evaluate if somebody is really, there's no exam to say, are you the best diabetic in the class? We have to look into the motivational structures that apply to a system like this. Because right now, as research has it, one, there's not enough clinical proof to show that self-management practices such as these do in fact show an improvement in glycemic control. And two, no one has really shown us yet how effective the mobile platform is. And by effective, I mean one, what type of motivation it has towards self-management. Two, how it integrates collaboration among patient, healthcare provider, and caregivers, families, friends, etc. And three, how exactly is it going to sustain these new and improved behaviors? We talked about long-term, having this long-term behavior change. Is it in fact going to help towards this sustained effect? So this is just a quick figure of the mobile DSMS user. As you can see, we'll have the physiological meters, the mobile phone, and the group here is supposed to represent the community or support network, whether it be family, caregivers, or the healthcare provider. Research question 2. how to deliver the right information at the right time as to have the greatest impact. When we talk about right, and greatest, most of us computer scientists will say personalization. And when it comes to DSMS, we'll be looking at the location of the user, the culture. I want to make a special note on culture because here in the Caribbean, we're a very diverse group. We have a lot of holidays, and a lot of these holidays are religious, and through these religious holidays, we actually have as part of the ritual some sort of, whether it is food, giving up to the gods, or sharing. And we don't wish to have a system that does not take culture into consideration, because we want to respect the person's culture and maybe offer alternatives. Because at the same time, it's only if something is relevant to somebody that they will actually, feel comfortable to use it. We're also going to look at the person's age, gender, the stage of the illness. Stage is very important when it comes to healthcare, because the kind of support that you give somebody before they're diagnosed is different from initial diagnosis, is different from an established patient. And of course, previous knowledge, what the person knows already. The next question, does team-based DSMS using mobile telephony have an impact on the patient's healthcare practices, quality of life, and diabetes knowledge? Going back to the curriculum before, who is this team that we're talking about? We're talking about the physician, the nutritionist, the physiotherapist, the diabetes educator, the nurse, and of course, our community of friends, caregivers, and family. How do we all now support this person through the use of a mobile device? What are my proposed outcomes? The thesis will provide a comprehensive overview of the current DSMS practice in the Caribbean region and address the research questions outlined in this presentation, and open the way to further research, of course, in the field of DSMS using mobile phones. Implication, this could be of substantial benefit to the field of mHealth and to the notion of self-management support, particularly in patients with diabetes and generalizability. The research may be applicable to the management of other chronic diseases. So where are we going with this? Right now, I'm working on the experimental design. From October to January, I hope to focus on the design of the framework for the use of DSMS on mobile phones, as well as the development of a prototype using this framework. I hope once everything goes well that the user trials and data collection will start in February 2010, and analysis and presentation of findings to be conducted between June and August 2010. In summary, diabetes is a major threat to the populations worldwide, and the majority of new cases come from the developing regions. Current healthcare practice is tailored to the treatment of acute problems, whereas the chronic care model addresses the need for preventative care. DSME helps in the improvement of short-term outcomes. To sustain improved behaviors in the long term, DSMS is required. Mobile telephony is an attractive platform for the delivery of DSMS, as it is more interactive, tailored support for persons living with diabetes. Thank you so very much for your time, and if you need any further information, you can check my website at www.oxalis.org, and there's a special research section where you can find all the materials that myself, Dr. Mohan, have published on this particular area. Thank you.